Hello everyone, my name is Sergey Smolyakov. I am a leading specialist in fixing the position of the first cervical vertebra in Russia and CIS. In today's video I am going to tell you about this technique, how it works, what it affects on and where it can lead to. It is the most comprehensible description of this technique. So how and why does the displacement of the vertebra happen? Why is this so common? Usually, it happens in the birth moment. When the child is born, his muscles are relaxed. It is a decision of nature. So what is it for? In order to make the child soft, because when the child is soft, he can nicely fit through any shape. That's why it is provided by nature. So for the first 2 or 3 days, the muscles of the child do not work. Right in this moment, when his muscles are relaxed, he is soft and the body is flexible, his body is being physically affected. So the doctor pulls his head, twists it. There are a lot of obstetric techniques. The childbirth is being simulated by medicine. Sometimes a doctor presses on mother's stomach in order to squeeze the child out. I don't even want to talk about cesarean operation. It is a very difficult and rough operation. So all these factors lead to the collapsing of the neck of a newborn child. So when 1 or 2 days passes after the birth, the muscles are being activated, they start to work. As a result, the wrong position of the bone is being consolidated. It remains for the whole life. A human encounters with a lot of problems because of these displaced vertebra in his everyday life that lead to dozens of unhealthy conditions. So what does the displacement affect on? Where does it lead to? First point, it is an osteochondrosis and all violation of neck mechanics. For example, when the neck is jammed, when it is hard to turn it, when it hurts, when it is numb, when scapulars are tied, when salts are being deposited, when arms are numb, the finger sensitivity decreases. So all these things are the consequences of it. Second point is about head vessels. I'm talking about headaches, generally strokes, different aneurysm, troubles with neck vessels, blood clots, blood clots inside the head and neck vessels. So I'm talking about all the vascular disorders. The third point is scoliosis and joints, especially huge leg joints. Scoliosis is a curvature of the spine. Where does it lead to? Almost all back diseases, hernia, protrusions, discs offset, different kinds of orthotism and orthosis. And when a pelvis is oblique, which is a consequence of detected scoliosis, it leads to joint disorders, such as arthritis and limb movement problems. It can even lead to growing of the side bone on the leg, where the big toe is. And many other things. All diseases mentioned above are directly depend on the position of the first vertebra. I will rephrase it. If the first vertebra is not displaced, all those diseases simply can't appear in your body. So they won't occur at all. This statement may sound overwhelming, but I have seen it in practice. I have met people who have been to so many doctors and experts, but no one could help them eventually. Different procedures have been applied, but there was no result at all. But then he decided to fix the displacement of atlanto-vertebra. So the duration of the main action of this procedure is about 5 minutes. So this short action gave a patient the result that he couldn't achieve with any doctor. In fact, this is the technology of the first vertebra correction that I use. In other words, it is a natural but not medical way of body improvement. There are different techniques how to make a human healthier, so this is one of them. I would like to tell you about 2 key elements straight away. You should consider them separately. I'm talking about these 2 words. First one is natural. Natural means related to nature, related to natural processes of the body, including its inner conditions and mechanism that underlies of the body's functionality. And the second one is not medical. It means that it has no connection with medicine at all. I should explain it a little bit more. Let's examine the schema. This is a human, or to be more precise, a human body. It has been developing throughout the centuries of evolution. Therefore, it has been adjusted very precisely. A difficult process of development, for example, intestinal microflora and its microorganisms, nervous system, the network which connects all organs. These organs have evolved and their functions and actions have evolved as well. This is a very precise and thorough process. All these elements should also have got used to themselves and external environment. So what is a medicine? Usually it is represented by a cross. Medicine is one and a whole thing, and its branches we can shorten to one thing. Medicine is an intervention in the body functionality. That's all, nothing more. The intervention can be chemical. So, chemical? Well-known examples are pills, medicine, injections. I mean any chemical element that affects the human body and changes its functions. Another type is physical. Physical treatment usually being applied when the chemical one is not enough anymore. If you can't heal an arm, you should cut it off. Physical treatments are applied when things are really bad, when the medicine totally gives up. We can also include here different techniques such as manual practice, chiropractor, chiropractic, osteopathy, and many other well-known techniques. Nothing from above do not relate to either physical nor chemical procedures. The technique that I use is related to natural rules of the human body, and it is not related to outside influence. It is fully based on the body work. You can see a neck here. There are 7 cervical vertebrae. Take a look at the upper part. The atlanto-vertebra is marked with blue color. So this is the first vertebra. We talk exactly about it. The technology of first vertebra correction is our main topic. You can see the first vertebra here, and there is the second one under it. The first vertebra is marked with blue color. If you take a close look, you will see that there is a blank space between them. So what could possibly be here? If you look at the whole spine, you will see that it consists of vertebrae, and there are intervertebral discs between them. This is a spine which consists of vertebrae, and here you can see intervertebral discs between them. They look like small pillows. They are formations of gel which work as a shock absorber. They hold a weight of an upper part of the body, but there is no disc between the first vertebra and the second one. But why? To find the reason, let's discuss discs' purpose. Why do we need them? They connect the vertebrae with each other. This is a thick and solid connection. This connection is movable, that's why there is no discs here. Let's discuss the movability here. There is a kind of a joint here. What movability does it have? It works when we turn the head left and right. There is a joint which keeps our head moving. Why do joints exist in general? What is it? Take a look at the joint in the hand. Let's take a wrist joint as an example. Joint consists of 2 bones which contact each other. Its main purpose is to provide movability. These bones are covered with cartilage in order to prevent abrasion. There is also a kind of a grease between them. Usually it is a liquid which improves a glide. This is how it works. These parts work and it creates a movement. In this case, this joint provides the movement of the head to left and right. If the vertebra is displaced, it will work much worse. The worst outcome is that it doesn't work at all. Let's take another example. Again, a joint in the hand. If the hand is dislocated in this joint, what do you think will happen with the movability of the wrist? Of course, it will decrease sufficiently or won't take place at all. Moreover, it will be very painful to move this hand. So when a child is born and while after that, examine him. And if he is crying, if he has sleep disorder, if he is irritated or has nutrition problems, so you can know for sure his neck hurts. I mean physical pain and he feels it. That's why all the problems take place. When I fix the atlanto-vertebra of newborn children, all those symptoms and problems disappear after that. They disappeared literally a day after that. The children were brought home, and parents called me after that. They told me that everything has changed. The child sleeps and eats well, and his general development started to occur faster. Okay, let's move on. If the vertebra is displaced, this joint won't function properly. Where does it lead to? It leads to quite serious mechanical consequences. How does the turn of the head occur? I will show it to you with my bare hands so that you could see and understand it better. This is a neck, and 7 vertebrae are here as well. This is the second vertebrae. It has a small convex shape on it, and this is the first vertebra, which holds the head. It is placed like this. When a human turns its head left or right, the vertebra moves like this. The head and the first vertebra, they are moving together left and right. This part is a neck. It serves as a base. This is a pole and all the movement happens directly on it. But it is not moving, or at least almost not moving. This is a normal condition. But the vertebra is displaced, the movement is disrupted. It tries to move, but it can't. It doesn't mean that we won't turn the head, we will turn it anyway, but we will turn it like this. Can you see it? Which part is moving? Right, the whole neck is moving, including second, third, fourth and other vertebrae. So the whole neck is engaged in motion. This is the first vertebra. Let's examine the movement. So if all vertebrae move all together, all of them will be stressed because of the twisting movement. These are 2 vertebrae and 1 intervertebral disc between them. So when a man turns his head with displaced vertebra, the whole neck works. Therefore, intervertebral discs are under tremendous stress every day. Intervertebral discs are originally meant to hold the weight of the body. So the head is about 7 kilograms, and the weight rises for each vertebra down the row. So therefore, they can handle load and pressure, but only vertically. I have drawn the directions on the board. The discs are being loaded, but they can't endure the twisting load. This is what a joint made for. This is the movement that occurs. If this movement occurs here, the intervertebral discs will collapse. Yeah. Just imagine 2 parts and a gasket between them, which is bouncing and can handle a vertical load. If a type of the load changes and it will become a twisting load, the gasket will be ripped. Therefore, different intervertebral discs problems will happen. The discs can be displaced and worn out. There are also different types of hernia and protrusion. And there are a lot of more. All of them happen because the joint doesn't work properly. It is fully or partly limited. All of you may already have heard about osteochondrosis. Many of you did for sure. This is one of the most favorite and widely spread words among neuropathologists and neurologists. But what does it really mean? Osteochondrosis is a number of diseases which start with intervertebral disc collapse. What are they? If the joint doesn't work and the discs are being worn out, it will lead to, firstly, the disc can be displaced. This is the disease number 1. If it gets displaced, the convex may grow right here. This is disease number 2. I'm trying to use medical terms as less as possible. Every detail I'm talking about has its own medical name. I don't want to confuse you. This lecture was made for ordinary people, but not for doctors. Next, if this convex will continue to exist while being under stress, it may burst. Disease number 3. If it bursts, inflammatory process will occur right here. Disease number 4. Inflammatory process is usually very painful. Disease number 5. The pain will cause a spasm of the nearest muscles. Muscles contract in response to pain. So, if the body gets pricked somewhere, we will do something like this. Yeah. The body will shrink. This is the same thing we are talking about. The muscles contract here, and if they contract, the nerves which go from the spine to limbs will be clamped by these muscles. So, disease number 6. The muscles may also clamp blood vessels. Disease number 8. Therefore, blood vessels will transfer the blood not well enough. It means that the blood circulation in this area will be impaired. Disease number 8. If the blood circulation is impaired, different types of salts will start being deposited here, and so on and so forth. A lot of other problems. The whole chain of problems is activated, and the name of this chain is osteochondrosis. And the main reason of the intervertebral disc collapse is, as you may have already guessed, only one. This joint doesn't work properly. The cause is mechanical. It is very simple and obvious. Why can't the medicine still figure it out? I don't know, but this theory is very simple. Any engineer, any mechanic, any builder, any architect will understand me immediately. Okay, move on. Let's examine what's above the vertebrae. There is a head. I drew a schema. In fact, there are more than one joint here. There are 2 of them here. They are situated right there. And another one is here. The lower joint, as I have already told you, is responsible for movement to left and right. Look at their upper joint, which is between head and the first vertebra. It is responsible for head tilting. Movement back and forth. This information is enough to understand how the neck works. How can we apply that? For example, we all know the morning exercise are useful, especially head rotation. But is it anatomically correct movement? If you know anatomy, anatomically correct movement is head tilting, back and forth. Back and forth for the upper joint and left and right head rotation for the lower joint. These are perfect for morning exercises. This is just an example. Move on. Head controls the whole body, we know that, and a lot of canals go through neck. For example, blood vessels are situated here. They go like this. Go through the first vertebra and finally go to the head, exactly like this. I will use a red marker. It will be more comprehensible like this. Blood vessels go right to the head, passing through the first vertebra. This is a vertebral artery. I'm gonna write it, the vertebral artery. This is one of the main canals which provides head with blood. Imagine if this vertebra will be displaced in any side. Usually it can be shifted or rotated. This is a rotation, tilting, and shift. It can be any of these types of displacement. How do you think? Blood supply will be changed or it will stay the same? Yes, absolutely right. Of course it will be changed. The blood flow will be impaired. There are many other blood vessels passing in front of the first vertebra. As an example, carotid artery. Carotid artery. It goes not through the vertebra, but in front of it. It is very close to the first vertebra, same as vertebral artery. So the blood vessels that go from and to a head will be clamped. It is pretty obvious that it impairs the blood supply of the head. Such thing as intracranial pressure will start changing, therefore there will be many problems with the head. Newborn diseases, dropsies, oedemas, brain edemas, and so on. What are they? These are consequences of a disrupted fluid exchange between a body and a head. But why is it disrupted? Because the vertebra is shifted, so it clamps the canals. Headache, adults really suffer from it. But why? Because blood supply is being impaired, therefore the intracranial pressure is always different, can't adjust itself. So, thus headaches take place. What is the cause of the headache? Stress, physical load, heat, cold, and any environmental changing. It also matters if you're hungry, sleepy, and so on. How does it happen? The weather has changed. Atmospheric pressure has changed as well. Therefore, internal blood pressure will be adjusted to correspond to environment. The blood pressure starts to change. It is changing all the way to the head. Like this. It comes to the head, but the vertebra is shifted here. Therefore, there is a pressure difference, the difference between intracranial pressure and body pressure. This pressure difference is represented as pain, and you feel it. This is an explanation of weather dependence. If your body reacts to the weather, now you can easily understand how it happens. Very simple. There are many other canals in the neck. I'm not only talking about blood vessels. There are lymphatic vessels here as well. Lymph helps body to get rid of the trash, cell waste products. It removes everything that we don't need in the body. If the vertebra is displaced, lymph flow will be impaired as well. It can lead to any inflammatory disease of the head. For example, acne on the skin and even dandruff. Yeah, so dandruff, it isn't a joke. There was a case when a person fully got rid of dandruff after first vertebra correction procedure. Some more examples. Inflammation of the nose, sinuses, eyes, ears, and almost any point on the head. There are other canals, but I don't want to talk about them too much. But you can be sure that the first vertebra displacement leads to so many diseases connected with your head. Wrong position of atlanto-vertebra can lead to constant compression of the medulla oblongata, cranial nerves, vertebral arteries, and other blood and lymph vessels. Look at the place where the red dots are. Right here. Canals that go to the head and to the body can be clamped, which causes a bunch of diseases. They are usually treated with medicine, but these efforts are not very successful. So, the next thing which is being affected by position of the first vertebra is our posture. What happens if the first vertebra is displaced? This is a correct position, and the vertebra here is displaced. As we can see, the spinal curvature occurs. How does it happen? This is the first vertebra, everything below is a spine. When the first vertebra is displaced, the spine follows its curved line. Therefore, it leads to a spinal curvature. Let's examine it more technically. Let's have a look. This is the first vertebra. The head is on the top of it, and there is a spine below it. When the first vertebra is shifted, the head which lays on it will be shifted in a certain side as well. Maybe you have noticed one thing when you had made a photo for passport, or maybe a hairdresser asked you once to keep your head straight. But what's wrong with it? It is not straight. As for me, my head is pretty straight. Okay, let's move on. Let's examine it. There is a vestibular apparatus inside our heads. This is an organ which works like a gyroscope. It monitors the balance. It keeps the head always vertically. A head takes precedence over the entire body. But why? Because it controls the entire body. This is a command center, a main office. It regulates the heart, the blood pressure, the work of the digestive system, and so on. So, the head is essential. That's why it is more important than spine. If we compare the vertical position of the head and vertical position of the spine, the body will always correct the head first. Because the head should always be vertically straight. This is a body's reflex that has been formed by evolution. Look what happens. When the first vertebra is displaced, the head is tilted. After that, the spine should control the straightness of the head. So it bends itself in order to keep the head straight. Ready? The head is straight now, or at least almost straight. Sometimes the angle is not enough. That is what we can see on photos or while visits to a hairdresser. But what is happening below it? There is a curvature below. It looks something like this. Therefore, the load will be spread unevenly. I have already told that a head weighs about 7 kilograms, plus weight of the body. So, all this weight exerts pressure on the spine. To be more precise, on the intervertebral discs. If the pressure is spread evenly, a body is able to withstand high loads, and the loads will be safe for the human. If the curvature takes place, look what happens. So, we will draw it on the board. This is the first plane. This is another one. Force vector, when the weight presses from above, will be directed to the left. A hernia will probably form here. This is a schema. Hope you understand it. The thickening will grow here. It will look like a convex at first. It is called a protrusion. And when the integrity of the disc bursts, it will become a hernia. This is the next stage. The doctors will probably recommend you to do surgery. Aims of the surgery could be, first, to cut the convex out. This is a light option. Second, when the surgeon takes several screws and inserts them into the vertebrae, in order to screw them with each other. Thus, their position will be correct. Just like this, with help of pins. Look. Usually, metal, titanium and plastic pins are used for this. It doesn't really matter. So the vertebrae will be locked. Even if we lock two vertebrae, there is still a spinal curvature below and above them. The position of first vertebrae is not correct. It will be alright for a while. But after that, two new hernias will appear, above and below of the old one. I will tell you a very nasty statistics. 90% of spinal surgeries and hernia removal cause deterioration. Yeah, deterioration, for real. Many doctors will scold me because I tell their secrets. 8% of spinal surgeries do not have an effect at all. So this is zero effect, and this is a negative effect. And only 2% of spinal surgeries cause improvement of condition. I'm talking about long-term effects. So these are long-term deteriorations and improvements. So what is the point to do a spinal surgery if it has no effect? Doctors will probably tell you, but I hope you won't have a conversation like this one. When they tell you that the surgery is necessary, that the surgery is not dangerous at all, don't believe them. Please, I beg you, don't believe them. Do not believe. One of my clients is a woman with a 2-year-old child. So the doctors did a spinal hernia removal surgery to a 2-year-old child. I think this is a true sadism. The highest degree of it. A 2-year-old can have a hernia by its definition. He has just learned how to walk. He hasn't endured any loads and stress which can cause it. It is literally impossible. Someone definitely wanted to earn some money. This is the best case. But the worst case is a common human stupidity. But it doesn't really matter. We don't pursue a goal to criticize doctors. I am a doctor myself, and many friends of mine are doctors as well. And many of them are good people, so my criticism doesn't apply to everyone. I just tell you these stories in case you find yourself in the same situation. I try to prevent your future mistakes. If the spine is curved, it will cause the pelvis curvature eventually. You may have heard about it. Look at my schema. What is under the spine? Obviously, legs. As you can see, the leg length is different. But why? This is not because one leg is shorter than the other one. Your legs are same. This is because your pelvis is curved. It is curved because the spine is curved. The spine is curved because the first vertebra is displaced. So the schema is very simple and comprehensive for everyone. This is about weight contribution. Thus, if the leg length is different, the stress of joints will be spread unevenly. Sooner or later, a patient will also encounter with joints diseases. Knees and hip joints are under the threat. It is very fancy to go to South Korea in order to fix the hip joint. You wouldn't have needed that if your spine had been straight. If it is straight, you can't encounter with these problems. If your spine is in the right place, your intervertebral discs will never be displaced and shifted. You also won't have a hernia, a backache, or osteochondrosis, which I have discussed earlier. So if the vertebra is displaced, it is very dangerous. How does it happen that the spine gets curved? I've heard many theories from not osteopaths. Give me a second to recall. People who choose proper shoes for you. Orthopedists. Orthopedist theory is that curvature goes from below. They say that we need to fix the pelvis. I'm about to prove the opposite. When children are born, what is the first common disease among them? This is torticollis. This is not a curved pelvis. The torticollis is widely spread. It means that changes start from the top. They begin at the top and go to the bottom. The body is destroyed from above. And the reason is the first vertebral displacement. How does it happen? The child is born, a doctor pulled his head too hard, the muscles are soft, everything is movable, as a result a displacement happens. After a year of growth, the problems start to occur. A child has a torticollis and it is okay until the first year. Because at this age, a child learns to walk. Yeah, because he really starts to walk. So his body used to be in horizontal position and now it is in vertical position. The load begins to occur from top to the bottom. His spine starts to curve from this moment. It starts to curve not when the school starts. It starts exactly when the child begins to walk. It happens at 1 year old, when he got to his feet for the first time. When the school starts, first and second grades, this is the moment when the chest starts to curve. So torticollis starts to spread all over the body. It spreads from top to the bottom. First, neck is curved, second, in first and second grade, thoracic region starts to curve. At third grade, the child sits at his desk in a terrible way. This is how posture curvature happens. A medical board comes and sees that the child is sitting crookedly. They make a simple conclusion: he has a scoliosis because of his strange sitting manner. It is not true. A doctor says what he sees, a very strange approach to the work. Thoracic scoliosis appeared because of the torticollis. It is caused by the first vertebral displacement. As he grows and becomes older, the curvature will continue to grow and will be even bigger. This time it is a small of the back, the end of the skull, and he will encounter with back aches for the first time. A strange condition suddenly appeared. This is what happens further. When he's an adult, the pelvis is curved, the leg length is different. If this is a woman and she is going to give birth, she will find out that her pelvis is curved. Therefore, there will be trouble with childbirth. Therefore, the next generation, I mean her children, will probably have the same injury, because of the difficulties while childbirth, and the circle will repeat itself. This is the thing that should be taken in consideration by all girls and women who are going to give birth. If you want your child to be healthy, if you want him to have a correct atlanto-vertebra, the first requirement is that your own atlanto-vertebra should be correct. This is first and essential requirement, and second is to decrease the interference in the childbirth process. I'm talking about interference by doctors. Do not allow doctors to make an injection of womb shrinking medicine. Do not allow doctors to pull or twist the child. Force pulling the child out and pushing on the abdomen is forbidden as well. I have heard different stories from young mothers. I've been told that a doctor even broke ribs of one of them in order to push the child out. Cesarean section is absolutely unacceptable. It is even more traumatic operation. It has both chemical and physical impact on the body. I mean, an anesthesia, rough obstetric methods, and etc. The consequences will be so difficult to fix. The best childbirth should be as natural as possible, using natural mechanics of the body. I wish you good luck. I wish you never face these problems. So write the comments, ask your questions, and see you soon. Contacts and inquiries. Phone number, Viber, WhatsApp.